Hi guys, thank you for taking the time to join us. As everyone knows, I'm totally in love with minimally invasive sinus floor elevation procedures for years now. Especially with those techniques that are based on the main principle of utilizing hydraulic or hydrodynamic forces due to their gentle treatment abilities. A lot of patients do not require any painkillers post-operatively, and those who do need painkillers will likely need significantly smaller doses for a shorter period of time. Let us have a look at a typical case. As you can see, we have two sites in the upper right premolar region. The residual bone height on the first side is 4.5 mm and on the second side is 1.5 mm. This case could have been performed classically with a lateral window, but as you can see, it is also possible to treat these cases utilizing hydraulic or hydrodynamic forces via a Crestal approach. For further information and details, please take a look at my other videos or just send me an email, but by granting me a minute, you will get a brief overview. I'm 100% sure that your patients will love it and that you will benefit from a word-of-mouth advertising. And even the patients with bilateral sinus floor elevations at multiple sites will have a smile for you the day after. But let us take a deeper insight at the possible alternatives. Let's start with the approach. It's possible to prepare a classical flap or to start with a flapless approach, which I do prefer every time we do not face a lack of fixed and keratinized mucosa. My favorite tissue punch is the ATP punch by Dentsply Sirona, but every other punch with a small diameter is suitable. There are several ways to break through the cortical sinus floor to enter into the maxillary sinus. Most techniques mandate drilling a pilot preparation that approximates the sinus floor to 1 to 2 mm. Afterwards, they are rather different. I would like to start with the Jeder-System. I've worked with this system for over 5 years now and would call it the gold standard. You utilize a small pressure chamber with a special drill. The water pressure assures that in the very moment of the first entrance, the Schneiderian membrane is pushed away safely by the flooding sterile saline solution, which is documented and shown by the real-time monitoring device. Other work groups like the inventors of the intralift or the physiolift system utilize piezo surgery tips, like the ones on the first two pictures. Some work groups prefer special burrs and drill, for example the Denser burrs by Versa, or the STA kit by Neobiotech, or the CAS-Kit by Orten. Most groups elevate the Schneiderian membranes utilizing sterile saline solution, sometimes with Spribant forces, for example the Jeder-System, or by hydrodynamic forces, which is preferred by the intralift users. Some clinicians prefer hydraulic forces, which I am going to show in a video shortly. Some prefer to elevate the membrane by utilizing the bone substitute or space-making material, which is also possible. On this photograph you can see the Jeder guide with the clear silicon sealing element, which maintains the tightness of the pressure chamber against the soft tissue, or the osseous structures when performing a flap procedure. In this video you can see the physiolift system that contains different hollow implant-like screws, with a water hose connector and a syringe holder to ensure a moderate advanced movement of the syringe Schlange, thus reducing the maximum water pressure and the risk of perforation. On this photograph you can see a component of the CAS-Kit by Orten, which is made of polyurethane and is ready to be connected with a hose and a syringe to inject sterile saline solution under the Schneiderian membrane. By this time we should already have achieved the following: The Schneiderian membrane has been elevated and the water which had been used for the elevation has already been removed. We have ensured that no perforation had occurred. The last step is now the insertion of the grafting or space-making biomaterial. I often spend most of my time performing the grafting portion. I had very often taken much more time to carefully insert the bone granules than to perform the breakthrough and to elevate the membrane. The only moments I felt insecure during these minimally invasive sinus floor elevation procedures had been the time of grafting, and so I've tried lots of alternatives to these classical bone granules. I discovered 2 papers which were very interesting for me. They were published by Stephen Ho et al. From Toronto and from Gianguido Corsello et al. From Milan. Stephen Ho utilized poloxamers as a biomaterial carrier for BMPs in rabbits' maxillary sinuses, and Gianguido Corsello utilized solely poloxamers as the space-maintaining biomaterial in 2-stage sinus elevation procedures. No adverse effects occurred, and after 6 months, 45 to 60% of newly formed bone was found. It amazed me. This material is very safe, harmless, and predictable to use. Furthermore, it is user-friendly and easy to apply. Another benefit is that it's cost-effective. In this video you can see that it's liquid when it is stored in a refrigerator, and it becomes a very stable gel at room and body temperature. It is nearly completely resorbed after 6 months, and it is replaced by larger proportions of endogenous bone, which is wonderful to see. This kind of material can also be swallowed by patients who suffer by esophagitis due to reflux of gastric acid, or it can be utilized as a carrier of local anesthetic agents in periodontal pockets. On the left side you can see the solid gel state, and on the right side the liquid state of the poloxamer. Both states are reversible and controlled mainly by temperature. The processing guidelines and tips are very easy to memorize. The poloxamer should be taken out of the refrigerator directly before application. I prefer a temperature of 3 degrees Celsius. It should be drawn sterile into a 1 milliliter syringe. If you have utilized a small punch or the ATP punch, it fits perfectly into the tissue tunnel. If you have utilized a bigger punch or you need a proper sealing against osseous structures, you can slide a piece of sterile silicone irrigation hose over the syringe tip if needed. You can see it in the video. Push gently the amount of poloxamer you have calculated underneath the Schneiderian membrane and wait some seconds until it is gelled. If you will need further amounts, please repeat. And finally, if you can ensure primary stability, place your implants. If you can't, please ensure a proper wound closure. Thank you very much for taking the time to join us here today. It means really a lot to me. Finally, I would like to finish off with some radiographic impressions. I hope you enjoy them. Have a nice day, and I hope to see you soon. But before I leave, I want to say thank you to 2 special colleagues. The first one is Dr. Klaus Eder, the inventor of the Jeder-System, for inspiring so many colleagues like myself. And the second one, who I'm really looking forward to finally meeting personally, is Dr. Pavel Crestal from New York, who invented my beloved VGO set and who helped me with the production of this footage. Cheers my friends, and I hope to meet you soon.